Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. If you are Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. All right, Sarah, tell me what's going on with your back. What happened?
So I've had pain since I was about 14 from doing street sports.
Okay.
So it's not very safe. And so from about my sacrum, sacrum area up to
neck?
my neck. It's just very tight, and if I sit for too long, I hurt. If I stand for too long or lay down for too long, any position for too long hurts. And it's,
Do you have constant pain or just when you maintain one position for a long time?
No, I have constant pain.
How much constant pain from 0 to 10?
I'm usually with my back. It's usually about a 3 or a 4.
So
like right now, I'm at
3 and 4.
Yeah.
You feel the entire back or just in the on?
Right now, I feel my
back?
entire back.
The entire back.
Like
3 and 4.
well, the whole maybe from my bra strap down is where I
Okay.
feel it.
Okay.
And so it's
So that's for about like 20, 30 years or something like that? Okay.
yeah.
So what aggravates your symptoms? What, like you said, long sitting, long standing? What else?
Standing is about the only thing that will relieve it for a little while. But then I
Okay.
can't do it for too long, but I can do
Okay.
that the longest.
Mm-hmm.
If I sit, I have to sit straight up because otherwise it starts to hurt. So if I slouch for too long like that aggravates
How
it
much
right
from 0 to 10 at worst?
there. That goes up probably maybe 5 or 6.
5 and 6. And
Yeah.
the sharp, dull, aching?
Aching, sharp.
Mm-hmm. Any pain going down to your legs? Or just stopped by the glute area?
It only goes. It can start to go down my legs. It starts to feel real tight, but it's mostly my hips.
Your hips, okay.
And this area of my back here. Like I start to feel it up through
Okay,
here.
it's more on the right side.
It's on both sides,
Both
but
sides.
like right now, for whatever reason, this position,
Mm-hmm.
everything hurts right there. So I would say it's at about a 6 right now.
6, yeah.
And that's my normal. That's my normal pain
For the
level.
last, like
If I'm at a 3, then I'm having a good day.
Oh, okay. So, for the last 20, 30 years, what kind of treatment you had for your back?
Chiropractic.
Okay,
That's it.
that's it. Did you have massage, physical therapy, or anything else?
I only had physical therapy when my daughter was born because of the cesarean.
Mm-hmm.
They hit when they gave me the spinal. They hit something, and I had to go through a few months of physical therapy for that, and it improved.
Okay.
But that's the only physical therapy, and that was 20 years ago.
So you had C-section how many times?
3 times.
Okay. So I want to take your range of motion, see how far you can bend forward, and let me know if that aggravates your symptoms. Let me know from 0 to 10 how much pain.
Okay.
Okay? Okay, so we'll have you stand up. So do the motion that I'm doing, okay?
Okay.
So you're gonna slide your arm down and really see how far you can go down and marking your legs because that's gonna be our baseline.
Okay.
Okay?
So.
And start when the pain increases.
Not right there.
So it's about like a little bit lower than the knee, like an inch or 2.
Yeah.
How much pain from 0 to 10?
I would say that puts me at about a 4.
4. Okay, let's stand back. Oh, you really don't have much motion there. Let's twist left and right. You're very stiff. So you're guarding now because
not even
it's
hurts up through
pain.
here.
Okay. Side bend left and right. So which one aggravated worse?
That right there hurts my lower back
Mhm.
pretty good. And then that same exact thing.
Okay. All right. So it's okay. We'll start in the stomach first, lying on your back, head over there, and then we'll work on the back because you said you had C-section.
Yes.
Okay. So after the surgery, did your symptoms change or?
After I had the babies,
Yes. Or it
Well,
was the
with
same
each
kind?
child, of course, I gained weight and aged, and so I would say yes, because you have a multiple of things.
So did you have any like complications?
During pregnancy, oh yeah,
Okay.
I had
So
a lot of
just like
complications with, especially with my boys.
Okay. So how's your breathing? Opening your lungs, do you feel like it's kind of like not having full range of motion? You feel like it's something putting pressure on it?
I don't know.
Okay. Did your chiropractor work on the front here?
Only on the sternum.
Okay. That's is that too much? How does it feel?
There's a lot of pressure, and there's
Pressure is fine. Pain
Right.
is not fine.
there's a tiny bit of pain, straight through
Sorry.
here,
Mm-hmm.
on both sides. I guess right there,
Is that painful?
a little bit.
Okay, what about here?
Yeah, a little bit.
Okay, here. Yes. Okay.
It's all mushy. So
Yeah, that's too much. How's that? I will assume no pain as long as you're not saying anything, okay?
right. Well, and I feel like I have a relatively high pain tolerance with all the pain that I've endured. So
You went through a lot.
yeah.
Yeah. Okay, gonna work on your scar tissue, okay?
Mhm.
You're gonna feel cold. You feel that?
Yeah. It's not bad.
You feel the
It's
grinding
weird.
here.
Yeah.
Yeah, I'm not surprised.
Hmm.
This is really grinding, very grinding. But I have to really dig in to get deeper. If I'm superficially, really not applying too much pressure, I'm not gonna get to the deep scar tissue because that's a deep cut in.
Yeah.
Okay, so when your husband work with you, give him a feedback,
Okay.
because if you don't go deep, you're really not really
Right.
gonna work on it.
Oh, it's very grainy, huh?
Yeah, it's like a washboard. Yeah.
It's the only washboard I have.
The only one?
It's the only one.
We're gonna revisit that. You have a scar
That was
tissue
a little bit
everywhere.
sore right there.
Sorry. Okay.
Wow, that's weird.
What?
Just the grainy,
The grinding?
graininess. Yeah.
Okay. Did you expect you will have that much scar tissue here?
No. I don't know why it would surprise me considering all
Well,
that it's been through.
Any
stressed out,
surgery,
down.
you have to have a scar tissue. If your body does not build the scar tissue, this will never close.
Well, would pregnancy also kind of contribute to that? Because, I gained 50 to 60 pounds with each child.
It could be if you strain your muscle.
Yeah.
But any cut, you have to have a scar tissue. It's part of our survival. The
Right.
problem is if your body does not dissolve the excessive scar tissue,
Yeah.
and that's in the way of everything. And this is what's gonna happen exactly. Gonna pull you this way.
Right.
You
Yes.
know? So you straight your back, you're really going against that probably like 10, 20 pounds, it depends on how
Right.
much pulling in there. So that's, I had a lot of patient chronic back pain because this is pulling forward in this way, and you can look in the back, you will see my jacket is start to get tight.
Right.
I'm gonna pull this way, it's all connected.
Yeah.
It's not, and that's, it's overlooked because there's not a lot of training actually to work on the visceral or the organ here. So a lot of healthcare provider they're scared to work on it because there's no training on it. You know, if you don't know how to do it, it's not exist. Or, but you feel all that grinding. Yeah, it's kind of loud here. Very like, I can feel the vibrations like that will like this. I don't know if you can see it, but it's going deep. Basically, I'm able to go like at least 2 inches deep with this. Can you feel that? Yeah.
It gets stuck, huh?
It gets stuck, yeah. And here, the whole area here. Yeah, I will not be surprised. Like the other surgeries, you will have an issue with that. You have a large scar tissue. You can do that on your own, by the way.
Yeah.
It's very easy to work on your stomach. So it might take you a few sessions to really get it totally like released. Okay, can we get some water, please? So, because I just doing process of elimination, it's stand up. And I wanna see if that made a change on your back. We'll have you drink some. Oh, is that your water? So the constant pain, how much from 0 to 10? Have you sit and tell me how's that? Working on the stomach, made any changes?
So what position are you wanting me to do?
So let's do the range of motion first. So you were a little bit like inch or two, a little bit underneath your knee.
Oh, I can go right there.
She's moving faster now. Okay,
Yeah,
where do you feel the tightness now?
Actually, most of the tightness,
The
I
hamstring.
feel it right here and
back.
back here. Yeah. back
So
here.
working on the stomach, that
But
means
coming up is slower.
Okay, let's go backward. How's that? Any different with that?
I feel like I can go back further.
You're not making faces, you see that?
Right. Yeah.
Twist left and right. That's
further.
more. That's more.
That's further.
That's more
That's
too.
further.
Side
And
bend
I
left
feel
and
it
right.
through there.
That's further.
Yeah.
How is that?
I feel it all through there.
Okay. So now you see the scar tissue in the front. That's why I started with the front, because it's really overlooked. Like,
Yeah.
okay, so we'll have, make sure you tell me if you feel any pain.
I will.
Okay, don't scream.
It's been there a lot of years, so.
Yep.
Oh gosh.
We said no screaming. Okay. I'm just joking. You can say like, relax your arm. You don't have to hold it. Just be comfortable. Even this.
Okay.
That's fine.
That's right.
Let me know if it's painful. What is that? How is that?
It's
Pressure is fine. But
pressure and just a little bit.
you see
Right
the
there.
tightness? I'm not even. Did you watch the video? You did not have. But
I've watched it.
oh,
my
sorry.
gosh.
The tool should be moving if there's no restrictions. You see that?
Yeah.
Not moving, stuck.
A minute. And it
Sorry.
hurts.
Hey, think about something you like, okay? Okay.
Oh,
Oh,
yeah.
sorry. You see? It's not moving. Normally it should move like this. You see the
That
mobility?
side barely moves too, huh?
Yeah, it's not perfect, but... So it's right in the spine? Oh, sorry.
Yeah.
Oh, sorry. Okay. What about now?
That's better.
I'm not really getting too deep. I'm working on a superficial layer of your fascia.
Yeah. It's all sore.
Sorry. And I can feel it's a little bit warm here compared to this side, so a little bit inflammation on this side. Is that too much here?
It's not too much. It's tender, but it's not too much.
Make sure it's not painful.
Right. So painful on the skin or painful on the tissue underneath the skin?
Everything. We don't want to have pain anywhere, okay?
Well, then that hurts a little bit.
Okay, make sure you say something. Okay, so gonna work on the scar tissue. It's gonna feel cold, okay?
Mhm.
We'll see. You will see the map of the scar tissue from the redness, and I can feel
Oh
here.
my gosh.
That's
Oh,
sorry. Okay. Here,
that's better.
she has a knot here, but she has a thick one.
Oh.
Oh, sorry. Sorry. Gonna be gentle here. Okay, I might do the Magna Heal if it's mild inflammation. Is it painful too?
Yeah, a little bit.
Sorry, what about here?
That's better.
So it's starting here and it going down. Yes? And it's right on the
Yeah.
side?
Right there. You can. Did
You
you
can-
feel that right there?
Yes.
Right
yes,
there is
I
very
do.
tender. Right in that spot.
Yeah. Do you want to feel it or are you okay?
I'm okay.
Right there.
Sorry.
hurts.
Sorry. So it's, you see that redness? She has a big scar tissue here and a big one here. Compared to this side, this is not bad actually.
Yeah, that
Look.
one doesn't hurt.
Normal skin color
Mm-hmm.
compared to this.
That hurts.
You can see this is a scar tissue, and when you have the, if you have the tool and you really push in, you can feel the bump. Here's fine. Here a little. This is on the side too, yeah. So we actually can map the scar tissue area visually with the redness. That redness should disappear in 10 minutes. A little bit here, not too bad. Because you said on the sides too.
Mhm.
How are you doing there?
Um.
Make sure you breathe, okay?
Oh, okay.
We want you to breathe here, okay? Not too bad here in this side. So is it more on the left side? On like the side?
So, it's yeah, it's more on the left side. I mean, I feel it on all of it, as you can
Just-
see, but the left
So
side,
you
as far as
compare here to here. That's more scar tissue here. See more redness here.
yeah,
Compared to this side.
yeah, that I feel.
Is moving because that scar tissue in the way of everything, and it could compress on nerve ending, so it's make it irritated and sensitive. But you definitely can. Oh, sorry. Okay, there you go. Okay. Now we know where's,
Where the problems are.
you see,
Hmm.
big here. Okay. All right. I need to do a couple of things. We're gonna do it this way. Is that okay? I will work on the glute area. You covered. Yes.
Yes. Oh, that last area,
That's enough.
right there.
Too much?
no,
How's that?
Not too much yet.
Too much or no?
No.
Okay. Let me know.
That's painful.
Sorry. I'm actually really doing very light. I'm not really applying too much pressure here.
That side's not as bad.
I don't feel anything here.
Yeah.
Nope.
There's a little bit right there. Right
No,
there.
it's not like this.
Not like the other side.
It's not here. And here, paining right on the scar tissue. Right in there. So you might do, okay, let me do the Magna Heal
Mhm.
to desensitize this. If you have really mild inflammation, should be a few minutes enough for this, because this is the area that was sensitive. How are you doing there?
Good.
Let me do it in here. Put it here.
That's
So,
what I was doing yesterday.
yeah, you can definitely walk with it like this. You know, with the Magna.
It was hard because I wasn't sure exactly where to pinpoint. So
Mhm. Well, you push with your hand and feel
Right.
where is the tender area, so that will help you to figure out where is the inflamed area.
Mhm.
So you just push
Okay.
to feel it. Okay, let me see if I can dig in a little bit.
You can go further, right?
I'm pushing.
I start to feel it when it gets deeper.
I'm going a lot deeper than the first time.
Right.
I need to get
Yeah, right there.
Okay,
Hurts.
so breathe, think about something you like. Do me a favor, okay? I want you to clench both hands.
Clench?
Yeah. Do you feel pain with that or no?
With my hands?
Clenching. Yeah, let's make a fist. And focus on your fist. Focus on your fist. Do you feel pain with this? In
Yes.
the back?
Yes.
Okay. What about now?
Yes.
Okay. So she has inflammation there in that spot. Alright, let's do this. We'll have you drink a little bit more water and let's do the bending forward.
Okay.
Okay. So have you stand up, slide your arm down and see how far you can go. Do you drink water?
Yes. It's in green anyways. So right there, that seems further to me because before it was like right here.
It's almost
So-
like half legs, you know.
Yeah,
both way.
halfway down my shin.
Okay.
This side's just a little, not as far because of my shoulder though, not
Okay.
because of the back. So like
Do me a favor.
right there is, right there
Okay,
is
I want you
where
to
I.
do something. Suck your stomach and do 5 quickly. Down. 5.
Okay.
Yep. Back and forth. See how far you can go. Okay. See, before she was like going back was challenging.
Okay.
Okay. Now we're gonna slide it and see how far you can go. So the accurate side will be the right side because that's.
Yeah, this side.
Do you feel like you're able to go further a little bit?
Yes.
Okay, let's do
I've never
backward.
been able to do that,
For how long?
ever. I've never been able to go down there.
Okay. So let's extend. How's that?
Much better.
That's almost your full range of motion.
Yeah.
She's maintaining twist left and right.
Oh, twist. Wow.
That's normal. She's get her max here. The other side.
I've never been able to do that.
So you see, she might have, like, because the shoulder, we worked on the shoulder yesterday, there's more inflammation there. Here she more in proliferation stage, so she was getting faster result.
Mm-hmm.
Twist the other side and tell me how it feels. So that's a full range of motion twisting left and right.
I just
bend.
feel it in that one area. I feel the pain.
Let's do side bend.
Side bend. Right there.
In that same spot, the lower spot.
It's right here is where I feel it.
Okay, do me a favor because she might have like moderate to inflammation there. We're gonna put it in that spot. Just leave it in that spot and I will have you do the same motions again. And tell me if that make a difference. Let's drink a little bit more water. Is that the spot that was very tender when I was working on it?
Mm-hmm. Yeah. So
Any difference with the magna heel?
a little bit.
Okay, let's suck your stomach while you're doing this. Suck your stomach all the time. Okay, let's do the other side. How's that?
That one stretches all through here, and
Well,
then I feel it
at home you probably need to release the whole thing.
right there.
The legs front, working on the glutes, the
The
hamstring,
thighs,
the thigh,
everything.
and
Yeah.
everything. So let's do this actually. While you have the magna heel, I want you to bend forward and facing us. And
Okay.
see if that's gonna make a change.
About the same right there.
That's good. Okay. And we'll have you sit down and tell me the constant pain.
Mm. So I instantly feel it in my sacrum.
Lower in the sacrum.
Yeah.
So I did not work in that area,
Mm-mm.
but the area I worked on.
The area you worked on feels better.
Okay.
like, yeah, it feels much better.
The sacrum, you feel it?
Like right now, I don't feel like I'm really in any pain.
Okay.
Like I feel relaxed, and it doesn't feel like it's gonna bite me at any minute. Like it just, it feels more relaxed. If I touch things, then it hurts.
Because you have inflammation.
But, yeah.
Yes.
But otherwise, I don't.
So yeah, I give you the inflammation protocol. It might take you a few days to really follow this. Make sure with the diet and the supplements and all of that to calm everything down.
Okay.
Yeah. So what do you think about ASTR treatment for your back?
I think it's great. I've never.
Because you had a chiropractor for a long time.
I've gone to the chiropractor since my 24-year-old was in first grade.
Yeah, but you have not had that range of motion.
Never, ever.
Okay. Have you had any relief like this?
Okay. No.
Mm-hmm.
And in fact, after watching your videos online, because they're so helpful, I was going like this, and I felt this huge knot in my leg, and I got a pin, and well, no, like your thing, whatever, and I just held it there, just pressure, and it relieved it.
Well, the good news,
so
actually,
now I have the tools.
You have the tools, so you can actually work on the whole.
There's a huge knot right there.
So you had the tools yesterday. Can you give me a feedback? Have you tried on yourself?
I did. I didn't have any lotion, so I wasn't able to do any of that. But I did have the Magna Hilt, and I put it here for several hours, and then as well as on my lower back.
Okay.
For probably about an hour.
How do you rate how easy to follow the video, and how easy to use the tool on 3 levels: simple, moderate, hard?
I would say that it's simple to do once you now you know. Before I came, it looked simple, but now that you've done some of the work that you've done, it seems like it would be simpler, even more so. Like we would be able to do certain things at home.
Certain thing on your own. That's not really rocket science, kind of. You know?
Exactly.
Yeah.
And as long as, I mean, like some of the stuff, like I could feel it all in my thighs, so I'll be able to work on those. So
you start to be more aware now, oh, here's a problem that
I never would have thought to do my stomach.
Well, when you take the course, I go over step by step what area you need to do it for that body part. And I have a model that she works on herself to really, just to see how you can do it on yourself.
Okay.
All right, so feedback about the treatment.
I think it's great. I'm very happy because like I said, I've never been without pain. Since I was 14 and I'm 45 now, so I've had pain for a lot of years.
Yeah, for 20.
So, and I'm not feeling the pain right